Medurstand-Understanding medicine.
Professor Aziz Rehman, let's do the sixth cranial nerve now. And sixth cranial nerve has got, I think, the simplest possible function. It only controls the lateral rectus. And the lateral rectus is the one which moves your eyeball laterally. Of course, like this one, right lateral rectus and left medial rectus will move eyeballs to this direction. Like I am looking in this direction, right lateral rectus and this medial rectus. And if I look at this direction, this one, the left lateral rectus and right medial rectus will be involved. So we are going to test the lateral rectus, sixth cranial nerves, and one importance of sixth cranial nerve is that it has got a long root and it climbs over the bone, and even in condition where there is raised intracranial pressure, the sixth cranial nerve itself may be actually intact, but just because of raised intracranial pressure, there could be malfunction of sixth cranial nerve. So we call it false localizing sign. So what we do is, first of all, we ask a patient to look into the torch. They should be normally aligned. If sixth nerve is intact on both sides, eyes should be normally aligned. If one of the sixth nerve is paralyzed, say for example right sixth nerve is paralyzed, then right eyeball should be slightly rotated inward because of the unopposed action of the medial rectus. Similarly, if left rectus muscle is, left sixth nerve is paralyzed, then left eyeball will be slightly rotated inward, and because of the unopposed action of the right medial rectus. So that is one thing. How do we know that? We shine light into his eyes. In both cornea, the light is shining the central part. That means both eyes are aligned. But to make it further sure that both lateral recti are intact, sixth nerve is intact, I will ask him to follow the light while I move it in this direction. Dekhte jaye light. And when I am doing this, I am looking at the alignment of the eyes. Both are still aligned. And now I will do the opposite side. And I am still looking into eyes. Both are still aligned. So no sixth nerve paralysis. But to make it double sure, I will ask him if he has any double vision. यहाँ तो बिल्कुल ठीक है, एक है, ये एक लाइट है कि दो है? दो लाइट नजर है? नहीं, वो तो है, बोले एक चीज ओवरऑल लाइट तो एक ही है ना, बीच में दो नजर आ रहा है. एक लाइट है ना, ये एक लाइट है. और अभी उसी तरह है कि चेंज होगी? उसी तरह है. अभी उस तरह से? Okay, right. So if you have been asked to test sixth cranial nerve only, then this is all you need to do is just look into the eye, see the alignment and make the movement in just this plane, because the recti are involved only in this. But normally we test third, fourth and sixth cranial nerves all together. I think in the method I demonstrated earlier, if eyeball movement is intact in all directions and there is no diplopia in any quadrant, that would mean third, fourth, sixth, all nerves are normal. If there is diplopia, of course there is a possibility of any of these nerves paralyzed, but then there is another possibility. In some cases, some problem in the orbit can also be obstructing the eyeball movement, like some tumor, some other things that needs to be considered also. Thank you.